Senator Hawley.
Thank you very much, Mr. Chairman. Dr. Means, good to see you. Congratulations on your nomination. Congratulations also on the birth of your child. I'm the father of three. If you're like me, I suspect you've had a tremendous career already, but I suspect maybe that your family will end up being the most significant thing you do. It certainly is for me. I was just thinking I have three, as I said. My youngest is now 5, Abigail. As I left the house the other day, she had our Labrador, not a very well-behaved dog, I will say. She had our Labrador there in the kitchen, had his paw stretched out, and was painting his toenails pink. So anyway, you've got that to look forward to. Congratulations again. Can I just ask you, from a health perspective, can we think about AI just for a second? I want to get your views on this. This is a sort of a cutting-edge issue, obviously, that's evolving almost by the day. Data centers. We've got more data centers in this country, I think, than almost anywhere else. They're proliferating. They're needed, we're told, for AI development and so on. My question to you is about the health effect of data centers. Here's what I'm asking. When I am home in Missouri, I get asked a lot now by folks all across the state, maybe especially in rural areas like where I grew up, where there are more and more data centers. They say, we're worried about the health effects. We're worried about contaminants in our water. We're worried about a digital cancer alley. We've had some reports of migraines, vertigo, nausea, chronic sleep disruption from residents, not necessarily people who work at a data center, but just residents in the area. Now, all of this is anecdotal. I haven't seen any studies on it, but that's getting to my question to you. Is this something that we should be looking into? Should we be looking at the health effects, the wellness effects of data centers? I'm talking about these massive, massive centers for residents around. What do you that live around the area? What do you think about this?
First of all, thank you so much for your question, your kind words about family. It's an interesting question, and it's one that I'm so glad you're sharing. It's not one that I've actually thought much about in this specific context, but a core and passion of mine, and what I hope to bring to the role is really advocating for understanding how our environmental exposures are affecting our health. It's been understudied, and there's a huge commitment from the NIH, the Whole Person Health Initiative, and through Dr. Jay Bhattacharya's work to look at how these cumulative environmental exposures are affecting our health. And that's something that I hope to champion in this role. And so this would certainly fit squarely within that category. And I'd love to chat with you more about this if I'm confirmed.
Good. I look forward to that. I'm glad to hear you say that. You have been just an incredible champion for looking at these environmental factors as well as diet and the other things that you've been talking about. And who knows? I mean, correlation is not causation, of course. You're a scientist. This is all, what I'm hearing is anecdotal. I think what I read in the press is anecdotal, but maybe we do need a study on it. I mean, there's a sufficient number of these centers, and they're not going to be fewer. There's going to be a lot more everywhere. And the level of concern I hear from working people, these are just normal people. They're showing up to work. They're trying to raise their families, and they're concerned for their health. You know, there are concerns about costs and so forth, but just putting those aside, they're concerned about their health. And I don't know what to tell them because I'm not a physician, I'm not a scientist, but I do think maybe the time has come to say, well, we're going to take this seriously. I mean, we'll look at it, and we'll figure out what the truth is, and we'll figure out if there are things that we need to do to protect the health of our folks. So I'm glad to hear you say that you would make that a priority, and I look forward to working with you on that. Can I introduce you here in just the few seconds that I have remaining, 90 seconds or so, to a young man whose name was Adam Rain. I think we may have a poster of him behind me. Adam was 16 years old when he was groomed by an AI chatbot into committing suicide. I think, do we have, yeah, there he is. Adam was just an incredible kid. I've gotten to know his parents. He was a rock star athlete. He was a terrific student. And he started using an AI chatbot, ChatGPT in this case. It's all a matter of public record. He started using a chatbot to do homework. And over time, this chatbot introduced him to the concept of self-harm. He tried to commit suicide multiple times. The chatbot told him every time, don't tell your parents. He didn't. He's very close to his parents before this, I should say. I've met them. They're wonderful people. They've testified. Eventually, the chatbot instructed him on how to take his own life, and he did it using precisely the method that the chatbot recommended. Now, I'm sad to say I've talked with too many parents whose stories parallel that one. My question to you is it time to study the effect of AI chatbot companions for minor children? Adam was 16. You know, he's not even a college student yet. He's a kid. Bright kid, great kid, but still a kid. is it time to study the effects when it comes to mental health and wellness on these AI chatbot companions for minors?
And please be quick with your answer because we're
Sure.
running late.
Yeah, well, it's obviously a complex question and a tragic story that you're sharing, and especially hits so hard as a new mother. I think that you and I are in complete alignment that children's health and protecting minors is of paramount importance. I think a country that doesn't protect its children, has gone off course, and it's a top priority of mine to do everything that we can to make sure children are healthy and safe.
Good. I look forward to working with you on this. Thank you, Mr. Chairman.